Yes, a few years ago I went through a very painful experience in my life. I had severe back pain and neck pain, so I went to see my primary care doctor, which did an X-ray and just told me to exercise and make sure that I stretched. But the pain was so severe that I just couldn't exercise. So I decided to move on to a chiropractor. And the chiropractor would work on my back and neck, and the pain would go away as soon as I left, of course, her office, but then it would come back in no time. So from the chiropractor, I moved on to a neurologist who gave me a prescription and sent me to a physical therapist. And I would be seen by the physical therapist and the chiropractor at the same time, but there was no communication between these two professionals, and at the end I was left with the pain and being twisted back and forth, which did not help my pain at all. I believe it is important for professionals to work together to bring the best treatment for patients. And if the professionals who worked with me had collaborated together, it would have saved money, time, and it would have saved me some sanity as well.
My husband Larry this past fall had heart valve surgery, which involves cracking the sternum, and it's major surgery. And he had to have this done because he had a couple congenital heart defects, and this was preventive surgery. In the lead up to the surgery, when we were talking to the surgeon and his team, we told them also about his fibromyalgia, a condition he's had for years, and how it tends to go out of control when he has other health issues. They took extensive notes and said it wouldn't be a problem. He had the surgery, came out of it fine, but within hours after his surgery, his pain levels were spiking through the roof because the team that was caring for him in the ICU did not pay attention to all of the notes that they had made before he had gone into the surgery. I knew before we even went into the hospital that I was going to have to be Larry's advocate, and I was prepared to do that. Unfortunately, my expectations came totally true when they completely ignored everything that we had told them before the surgery and everything that I was telling them after the surgery. So I had to step forward and really be pushed back a lot at various points to get them to pay attention and for them to create a system by which they would deal with his fibromyalgia while they dealt with his recovery from heart surgery. And basically I had to step them through the process. And unfortunately they let his pain level spike to a point that when they asked me what we normally did, I didn't even have the answers because we never let his pain get that bad before we take action. Interprofessional practices is so important because the body is not a series of standalone systems. It's an integrated system that works together. And when you have one problem, for example, heart issues, all of the other parts of your body are involved as well. And in this case, we saw that with Larry's fibromyalgia.
So I have dysautonomia, which is an umbrella term. So specifically, I have neurally mediated hypotension, which means my blood pressure drops, and postural orthostatic tachycardia syndrome, which means when I stand up, my heart rate goes up. But it's a syndrome, so it affects all parts of your body. So it took me, I probably was born with this, but it took over 40 years to get diagnosed. But once I got diagnosed, treatment became another issue. I have a specific situation where I have a tooth that needed to be worked on. It just needed to have a crown put on. But because I couldn't find a dentist to work on it, it took about 4 years to find a dentist who would work on it. The tooth finally broke, and now the tooth needed to be pulled. So the dentist and my dysautonomia doctor needed to speak to each other because there were certain procedures that needed to be followed. And it took a lot of work on both their part and my part to try to get them to speak to each other. They finally did. The dentist did not follow the exact instructions. So I'm back to square one and going to another dentist, trying to do the exact same thing so that I can get this tooth pulled. The value of interprofessional practice is that obviously the doctors would be communicating with each other. So hopefully that would relieve some of the emotional, physical, and financial burdens that have been brought to me and to other dysautonomia patients. Most at this point, a lot of the communication is done online between patients. It's not done between doctor to doctor or doctor to other kind of medical professional.
My son's diagnosis, it was quite a journey. We realized at age 2 he was really only making one sound. We contacted our local infants and toddlers program and had an evaluation, had a hearing test. Everything was normal, and we started seeing the SLP from the infants and toddlers program once a week. He really wasn't making any progress after a few months, and she suggested that we see some additional specialists. We went to Kennedy Krieger, saw a pediatric neurologist. Everything was normal. Had an MRI at Hopkins. Everything was normal. They suggested that we increase the sessions with an SLP. We added 2 sessions with a private practice SLP. And really, he made some more progress, but the progress still wasn't there. So she suggested that we get some second opinions. And the second opinions, we went through that. Still, everything was normal. And eventually, I realized that my son's still not talking, and something must be wrong. But I'm going to all of these people, and they're telling me everything's normal. And I looked at it and thought, why aren't these people talking? In my experience, I felt there was a lack of communication with all of the different people that we were talking to. I felt like I was the advocate. I felt like it was almost like a Venn diagram, and I was trying to figure out from all of these people what was overlapping, what wasn't overlapping, what was supposed to overlap, what wasn't supposed to overlap, and really trying to figure it all out, figure out who I should be talking to and who should be talking. Eventually, what I did was get a summary from all of the different specialists, and that really helped with putting everything together in one document and sharing it with all the different people that we were talking to. What they found is that in each report there were these small insignificant details, but when you put them all together, it actually ended up being something that was significant that really helped my son's diagnosis. In order for my son to move forward and really make progress, eventually all of these people did somewhat work together. I didn't get them in a room. That would have been great, but it didn't happen. However, putting the summary together really helped, and then having the SLPs talk to one another on the phone was excellent in really moving forward and figuring out what he needed. It was a much more holistic approach to what we were trying to accomplish. My son is doing much better now. He's talking. He is still not a normal 3-year-old. However, he has made a ton of progress, and I feel like it was a result of finally getting all of these people together and talking.